Hello, my name is Chadi Alraies. I am from University of Minnesota. With me is Dr. Morton Kern. He's well known in the interventional field. Today is this first day in ACC 2015 in San Diego. Dr. Kern, welcome.
Thank you.
We have three questions for you today. The first question is, how do you see the ACC 2015 influence the fellows in the future?
Well, I mean, the ACC here, I think, has gone out of its way to really engage the fellows, make offerings for the fellows' education much greater, I think much more comfortable. We're just leaving an FIT Mix and Mingle session. It was overflowing with fellows to get a sense of their importance in the house of cardiology and in the field of specific areas in cardiology. So I think the ACC this year has paid much greater attention for much finer results, and I think it's going to be a wonderful time for fellows moving through the American College.
Thank you. What do you think about the ACC 2015? What is the most landmark session that you encourage the fellows to go and attend?
Well, as an interventionalist, I'm biased, so I think there's a couple of sessions that are worthwhile. And tomorrow on Sunday, there's a session on the STEMI approach for management of patients. Treat culprit only, treat all the vessels, the PRAMI approach, and then I'm involved in talking about whether we should use FFR in the treatment of the non-culprit STEMI lesions. So it's going to be a very fascinating thing. It'll engender a lot of controversy, but I think it'll stimulate thinking into the STEMI patient. So all things STEMI this year are starting to evolve, I think, in a stronger way. The second area, of course, is advances in dual antiplatelet therapy. The Pegasus trial was out. Some of the other features are starting to identify whether longer-term antiplatelets are a hot topic. And lastly, there's a variety of structural sessions that are novel, unique, and we're learning that these structural advances are really close by in our future.
Thank you. Our last question for you today is, how do you envision ACC in the coming 10 years implementing the patient care, research, and translational research?
Big question. 10-year view. Well, what I think is going to happen in 10 years is I think all of the fellows that I'm talking to today will be out there taking what they learned today and translating into application for our patients. And I think every year through advances that we have here at the ACC, we apply those, we test those, we see their outcomes, and we retest. So the methodology that we use to advance clinical care is born in the ACC, is fed to the fellows who take it on, carry it forward, and help the patients through this method. It's a lifelong learning process. I know it's a cliche, but it's a true one. So,
thank you so much, Dr. Kern.